The purpose of this lecture is to compare and contrast anatomy of the primary and the permanent teeth. While many of the primary teeth will resemble permanent dentition and some of the characteristics will be the same, some of the teeth are quite different. You should be able to make a list of the teeth that are similar between primary and permanent dentition, and also then be able to compare with their areas where there may be differences. You should be familiar with the general eruption sequence of the primary dentition, beginning with the mandibular central incisors, which will show about 8 months or so. They're the first teeth to erupt, followed then by the maxillary central incisors and maxillary lateral incisors, and then leading to the eruption of the maxillary second molars at about 2.5 years. So please be familiar with how these teeth, the general pattern of eruption for these teeth, and keep in mind then that the permanent dentition that replaces them will be the accessional teeth that we discussed earlier in the year. If we look at this slide, which represents comparison between the permanent dentition, so here we have a permanent maxillary central incisor and then the primary central incisor, we will see that there are quite similar characteristics in that these two incisors, the primary one being primarily a mini representation of the permanent dentition. That's true for all of the incisors in the canines. There are differences that we will discuss. When we get to the first molars, however, there are considerable differences between the primary first molar and the permanent first molars. So, and we'll describe these differences as we go. In general, you can see that the proportions are pretty similar. The roots are perhaps a little more spindly. Generally, the relationship of the primary dentition is a little bit wider in comparison to the permanent dentition. Not in actual measurement, but as ratios. If you look at the width to length, you can see that the primary teeth appear to be a little shorter or stubbier, I guess maybe, but a little wider in proportion to than the permanent central is. If we look at this permanent or the primary posterior tooth from a proximal view, you can see that there's quite a bit of contour on the primary molars. You can see the very significant buccal bulge here at the cervical area, very curved, high degree of curvature on the lingual surface as well. But the occlusal surface, if we follow the line here, you can see that primary posterior teeth have a phenomenon called occlusal convergence. If we look at the buccal and the lingual walls and how they relate to each other, they actually will converge somewhere over the occlusal surface, which is, if you remember on permanent dentition, and we look at a posterior area, it'll be more rhomboidal, right? So the permanent dentition will have more of a rhomboidal shape, especially on the lower, than the primary dentition, which has an occlusal convergence because of the extreme buccal curvatures and the extreme lingual curvatures. If we look at this diagram showing sections of the primary molar versus a maxillary permanent molar here, here's the maxillary molar, here's the primary molar. You can see that the big contrast is in the divergence of the roots. See, the primary tooth has a much smaller root trunk than the permanent dentition, and the divergence of the roots is very extreme. The roots are actually rather spindly, and this is to allow the premolar tooth bud, permanent premolar, to develop within those roots as it develops and then erupts and takes the place of the primary molar. One feature of this that you'll see is the enamel on the primary molar as compared to the permanent molar is much thinner. It's about 1 millimeter thick as compared to 1.5 millimeters to approaching 2 in some areas on the permanent molars. The other thing I will note here is the extreme shape and the size of the pulp chamber in comparison to the permanent dentition. the same number of pulp horns and root canals exists in the primary tooth, but at a much larger proportional scale when you look at the primary molar. So this translates into doing restorative dentistry and fillings and such as not on a primary tooth as being more difficult, because one has to be more precise with the preparations in order to avoid the entering into the pulp chamber and nicking a pulp horn. So caries is very important that we catch it quick and early in the process, so that we can then do restorative dentistry to remove the caries and allow the tooth to remain functional. This feature is illustrated in this x-ray picture of a primary tooth with a filling in it. You can see here the fillings are dense, and so they show up as radiopeg or white areas on the x-ray. Softer tooth structure cavities will, as in the pulp chamber, turn out to show dark. You can see here that there really is not much space between where the filling left off and the pulp begin in this primary tooth filling, and that's not a particularly big filling for this tooth. It's just there is not a lot of space to work with. One thing young parents always seem to be concerned about is the fact that primary teeth are whiter in color, and so during the mixed dentition phase, when we start seeing the mandibular incisors erupting, as you can see here, look at the beautiful mamelons on this tooth coming in. The permanent teeth are going to be darker because of the thickness of enamel and the way that the light plays through the enamel and the dentin. So primary teeth being quite a bit lighter, parents are concerned when they see the permanent dentition erupting at a darker shade that this is something abnormal, and it's not. It's perfectly normal. But you should be aware of that. Primary teeth do not usually erupt with mamelons. However, we are doing some research here at the school to document that some primary teeth come in with mamelon-like serrations at the incisal edges. They don't last long because the primary teeth wear fairly quickly, but there may be something that approaches mamelons on the primary dentition in the incisal areas, but it's not something that's a prominent feature. Now, as we go through the rest of this lecture discussing the differences and the similarities in the individual teeth between the primary and the permanent dentition, you should know and be able to list the parts of the teeth and parts that are similar, and also then, of course, being able to note the differences. So if we look at this model, which is a dentiform of a primary dentition in mixed dentition, actually, because if you see here, we have the permanent molars in place. So this would be about 6 years old, perhaps. This child, or this model, represents that. And if we look starting from the midline, we will notice that the primary dentition has a central incisor, primary lateral incisor, primary cuspid, primary first molar, and primary second molar, for a total of 10 teeth per arch. Here we are, you see the permanent molars at this point. And so in order to label these teeth or identify these teeth using the universal tooth numbering system, we have to recognize that we have 3 and 14 in this model, being the first maxillary molars. The primary dentition is represented by the letters A through J. So the same way that we start numbering the system in the universal system, we start with the upper right second molar, which is A, and then B, C, D, E, F, G, H, I, J, and then of course we drop down. Same principle as in the universal tooth numbering system. Then we drop down to the mandibular primary second molar and continue to label using our alphabet. So again, in this situation, we are noticing the permanent molars in place. You can see a class 1 preparation for filling material here in the permanent dentition as well as the primary. But we have number 19 and number 30 in place, being the first permanent molars. And then if you look and see that we go through K through T over on the other side the same way as we did in the upper dentition labeling tooth with the alphabet in the universal system. So K through T on the lower arch. Now let's look at the characteristics of the individual maxillary primary incisors, and we can see that it's pretty similar in basic overall outline form to the permanent central incisor. One feature of the maxillary primary central incisor is that it is wider mesiodistally in dimension than it is incisal cervically. So measuring from the CEJ to the incisal edge will be less than the mesiodistal dimension, where the lateral, the mesiodistal, is more like the permanent ratio, where the mesiodistal measurement will be smaller than the incisal cervical measurement. Again, you see here a single root, fairly broad in relationship, but again, these big cervical bulges or cervical ridges, if you want to call them that, really make for a constricture here at the CEJ, but a bulbous kind of fat cervical area here on these incisors. Very typical of primary incisors. It makes the root look kind of spindly in these instances. Now let's talk about the individual features of the primary dentition. So the mandibular central incisor, like the permanent central incisor, the mandibular primary central incisor is the smallest tooth. It is nondescript actually when we kind of look at it, because there's not a lot of anatomy to discuss. The feature that you'll see that is a big comparison between the permanent dentition and the primary dentition, other than of course the size, is the fact that we have a very, very strong cervical contour, cervical bulge on the primary incisors, on the facial and the lingual. So while there's not much difference in terms of anatomical, there's still marginal ridges, incisal edge position. Other than the tooth is smaller and has less enamel, is wider. The difference between the permanent dentition and the primary incisors is in the cervical bulge. So this makes this tooth look kind of fat at the cervical area, and the root looks pretty spindly. The mandibular lateral incisors are the same thing. Again, really not too much else to describe to you. Same basic principles as the permanent dentition, single root, narrower mesiodistally than facial lingually generally. And again, the very, very strong cervical bulge here that you see, very high contours at the cervical area of the primary incisor. Now let's start looking at the primary canines. So the maxillary primary canine does have one characteristic that is similar to a permanent tooth, in that if you'll notice in this diagram, the mesiobuccal cusp arm is longer than the distal buccal cusp arm. That's not usually the case. In most instances, like if we look here at the mandibular primary canine, you can see that the mesiobuccal cusp arm is shorter than the distal buccal cusp arm. The fact that it is not so on the maxillary canine is similar characteristic that the maxillary permanent premolar has, first premolar. If you remember back from your premolar lectures, the maxillary first premolar will have a mesiobuccal cusp arm longer than a distal buccal cusp arm, which is characteristically, that's the reverse. Most teeth, most posterior cusps, the mesiobuccal cusp arm will be longer than the distal buccal cusp arm. So again, similar characteristics to the maxillary permanent canines. The mandibular permanent canines the same. Again, specifically related to primary teeth, you can see this very strong cervical constriction with the cervical bulging in both instances, maxillary and mandibular. Very strong cervical ridges, constriction here at the CEJ as the crown has a strong curvature facially and lingually. Primary molars, again, the first primary molar is both maxillary and mandibular have very unique anatomical features that I need to point out to you. Both maxillary and mandibular second primary molars correspond much to their first permanent molar counterparts in the dental arches. But let's first look at the maxillary right deciduous first molar. As you can see, very typically we have 3 roots with 3 root canals. You have 2 on the buccal and 1 on the lingual, just like the permanent counterpart. Unlike the permanent counterpart, you see that the roots are widely divergent and there's almost no root trunk associated with this tooth. The anatomy on this tooth is variable. It does not usually carry a strong oblique ridge with it. It can, but it doesn't usually. In this situation, you can almost see that it is similar to a heart-shaped permanent second molar. But in this case, most national boards will refer to this as the primary molar that looks most like a premolar. And I think that you can envision that you have a maxillary first or second premolar here with maybe just the addition of these distal buccal and distal lingual cusps. Again, look at how far the root extends out beyond the crown form in this tooth. Really, the anatomy of this tooth doesn't resemble anything other than maybe perhaps a maxillary premolar. And again, you can see the widely divergent roots where the tooth bud or the tooth germ of the premolars would form inside that. And you can see, again, very strong cervical ridges, constriction, and you can, again, in this instance, you can see the occlusal convergence of the buccal and lingual walls that are there. If we look at the second molar, the primary molar, this, again, is a mini-me of the maxillary first permanent molar. Very strong trigon of cusps, fairly strong oblique ridge here again. The distal cusp arm of the mesiolingual cusp is fusing or blending with the triangular ridge of the distal buccal cusp. You may or may not have a fifth cusp of Carabelli and a fairly strong distal lingual cusp on this tooth. Again, in this instance, you can see the cusp of Carabelli here in this view, fairly strong lingual groove, not so strong buccal groove, widely divergent roots, again, 3 roots, 2 on the buccal, 1 on the lingual, widely divergent. There would be 4 or possibly 5 pulp horns in this tooth. There would be 4 or possibly 3 pulp horns in the first primary maxillary molar. Again, strong cervical constriction, strong cervical ridging, narrow CEJ, and so in summary, on the primary maxillary molars, the first primary maxillary molar will resemble a premolar in outline form and in anatomical characteristics. The second maxillary primary molar will resemble the first permanent molar in most aspects. Now let's study the primary molars, mandibular molars. And again, starting with the first, you can see primary characteristics are 2 roots, 1 on the mesial, 1 on the distal, just like the mandibular counterparts. You can see that this tooth really resembles no other tooth in the mouth or in the dentition, actually, because it has its own very, very unique anatomical features. If you look at the mesial surface of a mandibular first primary molar, it's very flat. very flat, as you can see both in these views here. The mesial surface is quite flat. It has a strong sigmoid or S-shaped CEJ on the buccal. Strong sigmoid S-shaped CEJ on the buccal. This is very characteristic of this tooth. That makes this buccal ridge extremely curved and quite prominent. This is something you have to keep in mind when you're making stainless steel crowns for these teeth, because you've got to get that stainless steel crown margin over that sigmoid curve, as you see. Widely divergent roots, again, to make room for the tooth developing premolar that will replace this tooth. The anatomy is usually 4 cusps, but the anatomy is quite different from what you would see in other posterior teeth. You'll have a very strong mesio-buccal cusp. You'll have a strong mesio-lingual cusp, but they will be fused in this area right here. There'll be a transverse ridge in most of these cases, most of these specimens that you see. This gives this tooth much like a mandibular first premolar, which also has a transverse ridge. A posterior portion of the anatomy, or a kind of a pit and central fossa area, and then an anterior pit and central and fossa area, much like the 2 pits or the 2 fossas in a mandibular first premolar. In many instances, if you have mesial caries in this tooth, it is so extensive and so large and so hard to fill, you really have to put a stainless steel crown over the tooth. If we look at the mandibular second primary molar, now we see a very familiar characteristic. It looks just like the mandibular first permanent molar. So you'll have 3 cusps, mesiobuccal, distal buccal, distal cusp, and then 2 fairly the same size lingual cusps. And you will have a mesiobuccal groove and a distal buccal developmental groove as characteristics of this anatomy. You don't see the flattening on the mesial surface as you do in the primary first mandibular molar, but you see cervical constrictions and cervical bulging and occlusal convergence of the walls, just like you do in most of the primary posterior teeth. So in summary, the mandibular primary deciduous first molar will have perhaps 4 pulp horns. It'll have 2 roots, mesial and distal. The second primary mandibular molar will have 4 to 5 pulp horns, and it will have 2 roots, again, mesial and distal. And the first primary mandibular molar will resemble no other permanent tooth in the mouth, or no other tooth in the mouth. It has its own very unique anatomy with a transverse ridge. And the mandibular second primary molar will resemble the mandibular first permanent molar in outline form and anatomical form. So again, in summary, the maxillary first primary molar resembles more of a premolar in nature. You can see the very strong cervical bulge here that this tooth has. The more 3-cusp form of the outline form of this tooth as compared to the second primary molar, which of course has very similar anatomy to the permanent first molar that you see here in this arch. So again, we would expect 4 or 5 cusps. This one does have the cuspicare belly, a nice oblique ridge. You can see how nicely that forms from the distal buccal triangular ridge and the distal cusp arm of the mesiolingual cusp. Very, very strong. Not so much of a oblique ridge in this tooth, in the first. And again, if we look at the mandibular primary molars, the first mandibular primary molar resembles no other tooth, with a strong transverse ridge that you see here, a angled mesiolingual cusp, as you can see, a very strong, remember it's got that sigmoid S-shaped CEJ and a very strong buccal ridge. The mandibular second primary molar will look more closely at a first permanent molar in that it has the same number of cusps, 3 cusps on the buccal, 2 cusps on the lingual, a mesial buccal groove, and a distal buccal groove as well as a strong lingual groove. So as we finish up our study of the primary dentitions, let's remind ourselves that the primary dentition functions are for chewing of food, of course, but it also stimulates jaw growth and helps affect the speech and appearance, and it maintains the space for the permanent dentition. These are all very, very important functions to the growing child. To illustrate the space maintenance, we can see from these bite wing x-rays that we have our premolars that are erupting into the space that's held by the maxillary and mandibular first and second primary molars. But I want to point out to you that primary molars are wider than the premolars that replace them. So when the premolars come in, they gain some space for the developing jaws to let the dentition come into a proper occlusion. So if we look at the maxillary first primary molar as being 7.3, the maxillary second primary molar as being 8.2, remember now our total for the premolars, permanent premolars, right, ours 14, so they're 7 apiece. So we gain about 1.5 millimeters in the maxillary arch, and we gain about 3 millimeters in the mandibular arch, so that's pretty important. The primary dentition also has a phenomenon called primate spaces, and if you look at most primary teeth, primary arches and dentitions, you will see that there is a space mesial to the maxillary canine and usually a space distal to the mandibular canine. So again, that allows for the permanent dentition to come in, oftentimes just a little bit lingual to the mandibular incisors that you see, the primary incisors. It's not uncommon for the lower permanent incisors to erupt a bit lingual to the primary incisors. But then as the patient starts growing and has normal function with the permanent incisors, they come in and take up the space. So this is an example of what happens here when we lose a primary molar and we've had loss of space because of drifting of the mandibular molar and perhaps distal drifting of the premolar, and then the premolars get impinged and they can't come in. So it's important to note that the primary teeth do hold a very important function in to maintain space for the permanent dentition to erupt. And of course, never underestimate the effect on self-esteem when the child grows up without a proper dentition, it affects the speech, it affects their overall self-esteem. So even though these are baby teeth, and yes, maybe they will be replaced, it's still very, very important to maintain their functionality and their health throughout their life of the child that during that time when they have the mixed dentition. So let's not lose sight of what's really important in life. This kind has sharp edges, but unfortunately the bridge is out ahead, so I'm not sure which has more significance to you. But primary teeth are important, and it's also covered on your national board, so it's as well as in your pediatric dentistry rotation. So this is the last new information that you'll get for the dental anatomy course, but it's also very, very important.